The Integrate TB project is a novel community-level healthcare integration that uses cutting-edge technology to screen for tuberculosis, cardiovascular diseases, CVDs, and chronic respiratory diseases, CRDs, in the hardly reached population who have limited access to healthcare. This project, awarded to Caritas Nigeria in the first quarter of 2023, is a TB Reach with 10 project funded by the Stop TB Partnership, implemented in 5 local government areas across Ebonyi and Nasarawa State. So far, the project has screened over 4,000 persons using the AI-enabled mobile X-ray, identifying over 1,000 abnormalities, linking 301 persons to TB treatment and over 700 to CVD and CRD's evaluation and treatment. Integrate TB is revolutionizing lung health integration in hardly reached communities. This initiative has instilled hope in a community that typically faces significant health challenges but lacks a straightforward way to access care. Through screening and linking to quality health care, over 100 individuals have received cardiovascular and chronic respiratory diseases care from distinguished internal medicine consultants in specialized clinics.
My name is Jodelo Zumba, medical doctor by training. I work with Caritas Nigeria as the project director for the TB program. Under the TB program, we have 2 projects, the Global Fund PPM TB project, and the one we're here to discuss, the Integrate TB project. So the Integrate TB project is Stop Partnership TB funding. That's the TB Reach, for which Caritas was awarded to run from January 2023 to June 2024. So we are working in partnership with Zankin Research Center, and the project is in 2 states, Ebonyi State and the Nasarawa State. Like the name implies, it's community-based integrated healthcare services that moves from the community, where we try to get services closer to the people to reduce the cost of accessing services. And as the name implies, it's integrated in as much as it's TB focused. But there are other chronic disease conditions that are attached to it, cardiovascular diseases and chronic respiratory diseases.
My name is Chidima Ezubi Okoye. I'm the project coordinator for the Integrate TB project in Caritas Nigeria. Actually, the Integrate TB project has other prongs, so it has like 4 major interventions. First, like I said, is the community outreach using the AI-enabled X-ray for TB, CVDs, and CRDs. Then the second one is community TPT initiation. So we're trying to, what major thing is that we're trying to take services to the people. We're trying to ensure that people no longer have to incur catastrophic cost of coming to the hospital. So we're trying to take both TB preventive therapy to the people. We're trying to incorporate the traditional child clinics for the children, so where the people seek health, we take services to where they are seeking health. Like I said, it has four objectives or 4 interventions. One is the use of the AI-enabled X-ray. The second one is the community TPT intervention. We also have the TB screening at the traditional child clinic and also at all these places they take children. Then we have the use of patent medical vendors for treatment support, for contact tracing and for TPT initiation. What are we trying to achieve? We're trying to make sure that healthcare is at the doorstep of the people. That's the major thing. We're trying to make sure that we integrate as much services as possible and it is accessible to the underserved population. One thing about the 2 states is that they have a whole lot of hard to reach. They are agrarian populations, so you have some similarities at that point. Well, one thing we are finding out as we are doing the outreaches is that Ebonyi is showing a higher rate of CVD, CRD presumptive. So we have 36% in Ebonyi and we are seeing 33% in Nasarawa. When you probe further, you look, one, Ebonyi has this quarry environment and we're working in Ishelu, which is a quarry community. And Ebonyi too, you know about the salt nature, the salt of the nation. So we are suspecting, we can't really pinpoint these things, but we are looking at why is it that CVD CRD presumptives is quite higher in Ebonyi than is in Nasarawa. But however, there are similar populations because Ebonyi is also an agrarian population and Nasarawa is also an agrarian population. They have heavy hard-to-reach areas. One thing I would also want to mention is that the point of moving X-rays to the hinterlands is very, very crucial and has brought a lot of interventions to both Ebonyi and Nasarawa states. Because one, you can only get X-ray, the conventional X-ray in the urban area, just in the state capital.
My name is Cherechi Onoha, client partner for Cure AI in Africa. So at Cure AI, we offer artificial intelligence-powered medical image reading solutions for X-rays and CT. And we're currently deployed in over 60 countries around the world. At Cure AI, our mission basically is to make healthcare more affordable and accessible using artificial intelligence. Caritas is using our AI in their Integrate TB project.
I come from Iguledoha in Izi local government. I'm Ogbaga Isuke. Ike is the one that carried me down to Sudan United Mission, where they're making a X-ray, chest X-ray. They get TB from me and they refer me to FOMC. I went there and see doctor. The doctor is the one that see me and they carry me down to where I do lab again for the second one. They write tab for me. I go and take the tab, and the tab I get is for high blood pressure before the one they give me for TB. And I'm free. My heart is okay. I'm feeling happy. Those that bring this program, I'm greeting Caritas Nigeria, so for their good work.
My name is Dr. Collins Washi. I'm a consultant physician and cardiologist. I'm head of Department of Internal Medicine, Alex Nkweme Federal University Teaching Hospital, Abakaliki, Ebonyi State. In fact, this project is a novel project, and what gladdens my heart about this project is reaching the unreached, and it also brings to fore the importance of artificial intelligence, which is part of what we are pushing for, because it aids diagnosis and you can make input even from the far area. In this Integrate TB project in Ebonyi State, it was initially set out to detect the presence of tuberculosis using AI-powered X-ray. They noticed that many of these patients had features of cardiovascular disease and also chronic obstructive airway disease. As we know that one of the commonest causes of death and morbidity, even among the developing countries, is cardiovascular disease. They wrote a letter and approached the department. We saw it as a good idea, and we felt that there's need for us to partner with them. And we said, okay, what you do, as you go to the villages and you take this X-ray with the AI intelligence reporting, we made an arrangement where they referred them to us. And since we started at barely about less than 2 months, we've been able to evaluate up to 60 patients sent for them. And we have seen people who have undiagnosed hypertension with already causing some cardiac damage. And many of them have been evaluated by us, placed on drug, and many of them are doing well.
I am Mr. Mwite Samuel, Ebonyi State TBL Program Manager, Awako State Ministry of Health, Abakaliki. It has impacted so much, it has helped in the increment of our case finding increment. Integrate TB is part of it. Why is it part of it? It is part of it because chest X-ray is a tool that is used to screen smear negative cases. And chest X-ray is gotten in the township. But Integrate TB has taken this mobile X-ray, AI enables, into the hard-to-reach areas. We go into the communities. We go into the markets. We go into the nooks and crannies of Ebonyi. And then we screen them. And so there's no transport fare for our patients and our presumptive cases. Caritas Nigeria has done a lot of things to us. When this mobile chest X-ray was handed over to our past commissioner, we were all glad. And then with the activities now, what is doing in Ebonyi State is showing that mobile chest X-ray is needed in TB program.
My name is Chukwe Bukaogu. I'm a research scientist at Zankli Research Center, Bingham University in Nasarawa State, North Central Nigeria. I am the M&E officer for the Integrate TB project, representing Zankli Research Center in the partnership between Zankli and Caritas Nigeria for the Integrate TB project. Prior to 2021, when we usually conducted active TB case finding in communities, the announcement usually will focus on people who had cough symptoms to congregate for community screening at a designated place. However, from epidemiological data, both in Nigeria and beyond, you will find that maybe out of 100 congregants, maybe 10 to 15 maximum will be presumptive people with TB, and of them, maybe 3 or 4 will be true TB cases. And the others who were also coughing and having other chest symptoms, we just told them to go home. So in 2021, when we met Cure AI at the National TB Conference and discovered that they had an AI tool that could not only diagnose presumptive TB, but also diagnose other chest conditions like an enlarged heart, like other chronic respiratory diseases, cardiovascular diseases, we saw that it was an opportunity to be more useful to the communities we served with TB active case finding. And I think that was when the idea was born about the Integrate TB project. The communities we serve have received it very well, because when we do an X-ray in the community setting, we tell some, look, your X-ray suggests that you may have TB. Now we need to do further tests. But the others, we tell them, look, your X-ray suggests that your heart is enlarged or you have other features of cardiovascular disease, and we're referring you to hospitals that we've already partnered to continue their care. And others have chronic respiratory diseases other than tuberculosis. And we found that the communities have been much more satisfied with the spectrum of services we were able to render. I think this screening approach has been more useful in terms of the entire pulmonary ecosystem.
My name is Nwale Nikechukwu Frederick from Zanyimagisi local government area, Bonny State. My role as a linkage coordinator in the project Caritas Nigeria is to establish a link between the community and the private and mission hospitals on the issue of TB case finding, diagnosis, and link them to treatment on the hub facilities. The local committee is involved because we go to the traditional birth attendants, we go through the patent medicine vendors, and we escalate our sensitization to the heart of the community. Those patent medicine vendors, the traditional birth attendants, and the traditional child clinic homes, we involve them in the program. Precisely as today we are in Onayim, Sudan United Mission Hospital Onayim, which is a very far distance from town.